Hi, welcome to Vantage Views. My name is Dawn Meglin, and I'm the Senior Director of Community Engagement with Vantage Aging. We're headquartered in Akron, Ohio, and we provide a variety of services to help older adults age in their own home and do so with dignity and independence. Welcome to our show today. We're very excited to introduce you once again to a member of the team with Alzheimer's Association. And we had Karen Elliott, a program director, on the show last November that was talking about Alzheimer's and the association and what they did and the different resources that they had for caregivers. And today we have with us Andrew DeFratis, and he's the communication director with the Alzheimer's Association. And we're going to be visiting with him today to find out some of the new facts and figures that have been coming out about our community here locally, how Alzheimer's is affecting our community, and maybe give you some tips on how you might be able to help later on. So, Andrew, welcome to the show.
Thank you so much for having me.
We're so glad that you're here.
Yeah, every opportunity to raise awareness.
Absolutely, right. So can you kind of give us a refresher on the Alzheimer's Association and what you're doing out in the community here?
Yes. So the Alzheimer's Association is the leading voluntary health organization in Alzheimer's care, support, and research. Locally, the Greater East Ohio area chapter covers 17 counties, including all of Medina County, Greater Akron, Greater Youngstown, and Canton. So a staff of about 12 of us are trying to support the caregivers and the individuals with memory loss and the professional community in addressing the 6th leading cause of death in Ohio and the nation. And that means a lot of community education, a lot of support for caregivers, like caregiver support groups, and educating professionals on answering the right questions when those opportunities come up.
So can you tell me a little bit about how many people with Alzheimer's disease are being supported in your chapter area?
Sure. So for our 17 counties, which you know, it's hard to imagine exactly where the 17 counties are, but kind of Medina to Warren to Steubenville to Zanesville, there's about 60,000 people living with Alzheimer's.
Wow.
And there's about 250,000 caregivers. We are reaching not nearly enough of those individuals. And in addition to that, a lot of our education can focus on brain health and risk reduction. There's no method of preventing Alzheimer's disease, but by incorporating certain healthy habits into your lifestyle, you can reduce your overall risk. And the research shows that if you incorporate multiple of those healthy lifestyles, you can significantly lower your risk. So while we can't prevent the disease yet, we have volunteers and staff out educating the community, educating our community partners on how to reduce overall risk so that hopefully we can make a dent in the number of people living with the disease. Like I said, in our chapter area, it's about 60,000. Across the state of Ohio, there's 220,000 people living with the disease. That's a intense figure. Over 5,000 people a year die from Alzheimer's. And we expect that number to grow to about 250,000 by 2025. So it's a 250,000 people in just 5 years will be living with this disease.
Why such a steep trend, such a huge jump or growth in that number? Is it because of the boomer population aging so rapidly at this time?
Yeah. Ohio is an aging state. And we don't have the infrastructure in place to lower and reduce risk at this time. We're actually just getting to the point where we're understanding how to diagnose the disease better. And even that is still a process of elimination game. Dementia, I think there's a lot of stigma and there's a lot of education that we have to provide because senility and memory loss, a lot of people think that's just a normal part of aging. But when you think of those stories of 100-year-old individuals who still have perfect cognitive abilities, that's one of the many examples that memory loss is not a natural part of aging. It is a disease. There are changes in the brain that we can point to, and we don't have a perfect system in place for identifying those changes yet. But with additional research, we hope to get there and make it easier on people to diagnose that.
So, Andrew, one of the things that we deal with at Vantage Aging with our clients in the Meals on Wheels program or our home care program is caregiver burnout and the demands on caregivers. Whether it's a spouse or a child, somebody in the sandwich generation that's having to take care of themselves, their own family, their own children, and then a parent that's perhaps battling this disease. What types of supports do you have in place for caregivers?
Sure. So the Alzheimer's Association offers a 24/7 helpline, 800-272-3900, that 24 hours a day, available in over 200 languages. A caregiver can reach out to the association to speak with a master's level trained social worker and answer any questions about the disease, about resources, about services, what to prepare for and how to prepare 24 hours a day. If it's 2 a.m. on Thanksgiving and a loved one is experiencing aggression, you can call that number and someone at 800-272-3900 will be there to answer those questions. And what the local chapter provides, which I think is very important, is that while that emergency crisis line is there, or if it's during the middle of the day and a professional wants to call it, it's also there during the middle of the day. But after the crisis, first response, the local chapter, we're able to connect with those individuals maybe a day or two later, depending on the situation, and say, speak to the individual, really walk them through what their experience has been so far, connect them with other community resources, caregiver support groups, maybe education programs, and that social worker at our chapter can develop a one-on-one relationship and work with them for maybe months or years to really say, this is what the next stage of the disease is going to look like. This is what you need to be preparing for right now. This is what's normal. This is what's not normal, and you need to bring up to your doctor. And we call that the side-by-side program. And like I said, the social worker at our office will develop that one-on-one relationship with individuals. And it's been shown to significantly reduce emergency room visits for individuals who participate in that program.
And it must provide such a strong sense of support to know that there's a community agency out there that can provide you as a caregiver that professional but personal touch to help you deal with something that's so intimate and so difficult and really hard to navigate. So that's an amazing thing that you're doing.
Well, thank you.
Yeah, that's great.
Really part of that stigma that we're constantly battling is, I always think of the Gene Wilder example. Gene Wilder had passed from Alzheimer's disease, and once he had the diagnosis, his family kind of cordoned him off from public life because we all want our loved ones to be remembered at their best, and as that decline occurs, we kind of try to pull them away. And that's why so few caregivers reach out to the Alzheimer's Association or even other services until very late in the process. We advocate that the earlier you reach out to us, the earlier that you reach out to services, the more you can do. That individual can have so much more control and input on their care plan, on advocating for the cause, on sharing their story. Something that personally inspires me in our mission. So I don't have a family member with Alzheimer's or dementia, but having worked with so many volunteers and seen a disease that really kind of creates a hopeless situation, being able to share your story, raise awareness, and engage the media and advocate to the government, that empowers them in a situation that otherwise they feel powerless. And I love seeing that sense in the families that we work with.
That's amazing, because it's really when we tell the story that really you can demonstrate the impact that it's having in people's lives.
And really so many people have a story. I mean, with 5.8 million Americans living with Alzheimer's disease, it's as we reduce the stigma, it's not so much these people that are not part of society. It's everyone has a family member or a friend who's parent or a loved one or a neighbor. Everyone, the number of people with a connection to this disease continues to grow as the prevalence increases.
Wow. So you just released your facts and figures report. Yes. So can you tell me a little bit about that? Because we were talking before the show and I had my mouth kind of hanging on the floor. I was shocked.
Sure. So the Alzheimer's Association produces an annual facts and figures report, and it goes out to professionals, it goes out to our community partners, it goes out to the federal and state governments, and it really provides the reliable statistics that inform government programs, community programs around Alzheimer's disease. In 2020, about 5.8 million Americans are living with Alzheimer's disease. For every one of those individuals, or another form of dementia, I should include, that Alzheimer's is about 80% of dementia cases, an umbrella term for other memory loss diseases that impact daily life. Okay. Alzheimer's is a big part of that, but there's about 100 other forms of dementia. The Alzheimer's Association and a lot of our community partners serve all of those. Okay. But about 5.8 million Americans are living with Alzheimer's or another form of dementia. About 220,000 Ohioans are living with that same Alzheimer's or another form of dementia. And we've seen really the call to action right now is that not enough geriatricians exist to meet the need that is coming on as Ohio and the country ages. About 82% of primary care physicians say that they are the first line of defense to address questions about Alzheimer's disease, but less than 50% of them say that they're prepared to answer those questions. So there's a lot of instances where people are doing the right thing. They're going to their doctor, they're asking the questions, they're trying to get a diagnosis, but even that primary care physician doesn't have the training or the time to answer all of those questions. So the association is advocating in Ohio and at the federal level to do all that we can to raise education for primary care physicians and geriatricians, and provide more of a social network of services to support those caregivers.
Wow. Mm-hmm. I was just startled. I know that we're seeing that more and more in the aging communities, that we just do not have enough gerontologists to deal with the issues that are facing our population of aging.
Yeah, I think we think of, the doctor profession as, oh, that's a well-paid, we all want our child to go marry a doctor.
Every child needs to go to college and be a doctor, right?
But in terms of the different specialties, there are not enough geriatricians in particular to meet the need. Our estimates, as part of our facts and figures, is that there's, I think, 163 geriatrician specialists in Ohio, and by 2050, we will need to more than triple that. And according to the facts and figures, we need to triple that in almost every state, except for the states where we need to multiply that number, the current number, by 5. So across the country, at least 3 times as many geriatricians, if not 5 times in some places.
And that was the number that startled me the most. That it's that huge of a need.
That's that we are not prepared for the aging community that's going to come up based on the number of individuals who have Alzheimer's disease as part of the aging community now, and how many we foresee between now and 2050.
So everybody needs to change their major now over to being a geriatrician. Mm-hmm. So did the report say anything about the impact Alzheimer's and dementia has on caregivers?
Well, I think, like you said, the impact on caregivers is that it's a physical, emotional, financial burden. If caregivers are not working more hours to pay for the care for the loved ones, they are taking time off. It's impacting the workforce. They are readjusting their entire life. Many of them drive, if they're not living with their loved one who has memory loss, some other caregiver in their life is probably driving about an hour to go and visit and help care. For every individual with memory loss, there's about 2 to 3 caregivers providing unpaid care. Add to that the paid individuals who might be working through an assisted living facility or a senior center. And it's just, there are a lot of people working to support our loved ones with memory loss. It's a cost to the nation of about $305 billion a year. And that's about $205 billion of that is through Medicare and Medicaid. So this is the 4th year in a row the cost to the nation has been more than $250 billion, and we expect the cost to the nation to exceed $1 trillion by 2050. And that's, those are kind of the road stops that we're measuring by. I mentioned 2025 earlier. Without a method of preventing, treating, or slowing down Alzheimer's disease by 2025, this is really going to, we're going to have to readjust a lot of how the government spends money on healthcare to address memory loss. The current system is not sustainable, and that's one of the reasons that we advocate so strongly and fundraise in all of our communities for Alzheimer's research. If we can just find a method of slowing the disease, the onset of the disease down by maybe 5 years. People living with the disease are living with it for a smaller amount of their life, and that's a significantly less funds that the family and the government is spending on care for that individual in that time frame. So in 2010, the Congress passed the National Plan to Address Alzheimer's Disease, which has recommended incremental increases to Alzheimer's research as the research community has the infrastructure in place to support it. So we're not just going to Capitol Hill and saying, give us $1 billion.
Right. There's a plan.
The scientists are saying this is how much the research community can do in the next year with this much research funding. So we've been fortunate that Alzheimer's research funding has been supported in these last 5 years or so. We've really quadrupled the amount of research funding at the federal level. And just in the last year, the state of Ohio, up until recently, well, I guess even currently, the state of Ohio is the last state in the nation that does not have a plan to address Alzheimer's disease. So our volunteer advocates have been working with every legislative office in the state of Ohio to get the Senate Bill 24, which is now passed, to develop a task force which will write Ohio's plan to address Alzheimer's. And that will cover community and state supports for caregivers, whether the state of Ohio sees it fit to invest in research or invest in research centers or additional caregiver centers, or better education for those primary care physicians, or better education for first responders. But like I said, up until recently, Ohio did not have had not made any progress on a plan to address the disease. And now we have the task force that will write the plan, and we're hoping to see that within the next year or two.
That's wonderful news. I don't think I was really aware of that, and so I'm really glad to see that Ohio is stepping up and contributing to solutions as the Alzheimer's Association.
One of the legislative sponsors for the state plan said, and always said, the best part about being last is that you get to be the best, and you get to steal the ideas of everyone else who's come before you. So we're going to be the best.
I like to call it R&D.
Yeah.
It's rip off and duplicate. Really
Exactly.
find out what else is going on out there. So you have a state advocacy day coming up in April. What can people do to advocate for the Alzheimer's Association?
Yes. So I've mentioned the state plan and the various elements that will go along with that. We are not putting all of our bets on one horse. We are still advocating for a number of different legislative options up until then, especially training for first responders. The number of individuals who wander with Alzheimer's disease is so high that it's inevitable. Most first responders will interact with someone with memory loss. And right now, Ohio has no required training for first responders around dementia and memory loss. So we're advocating for House Bill 441. And at our State Advocacy Day on April 21st at the Ohio State House, we'll be gathering more than 100 advocates from across Ohio to meet with every legislative office. For individuals who want to look into participating in person that day, or if they want to participate virtually, they can make phone calls, they can email their legislator, they can participate on Twitter and Facebook, because the legislators do pay attention to those. An individual who's interested in supporting the cause, caregiver or otherwise, can go to alz.org/advocate, and all of our advocacy and legislative priorities are there at the federal level and the state level, and that'll give you an option to sign up and be added to our list for additional opportunities or take action in the moment.
Wonderful. Great things out there, Andrew. That's amazing. So the Alzheimer's Association just recently joined the VANTAGE Aging team as a volunteer station for the Retired Senior Volunteer Program in both Summit and Medina counties. We're really happy that they've joined us, and I wanted to share with you some of the volunteer positions that are currently open so that you can continue to not only advocate and support the great work that Andrew and his team is doing at the Alzheimer's Association, but really give back locally. We're looking for caregiver support group facilitators, community educators, community representatives, and faith outreach representatives. So if you are interested in learning more about volunteering with the Retired Senior Volunteer Program to benefit the Alzheimer's Association and the great work that they're doing here locally, all you need to do is visit vantageaging.org/RSVP, and we have all of those volunteer opportunities listed there and even a sign up form for you. So we want to thank Andrew DeFratis, again, Communications Director with the Alzheimer's Association, for joining us today. It was very informative. I learned a lot. I think you guys are doing some amazing things, and I know we bump into each other all the time in all of our aging work that we're doing together and collaborations, and we are so glad that you were able to share this great information. And if they want to find out more, we want to give them the phone number and website once more.
So the 24/7 helpline is 800-272-3900. To learn more about our local services, you can go to alz, like Alzheimer's, .org/East Ohio.
Wonderful. Thank you again for joining us today on Vantage Views. Remember, we're not growing older, we're growing bolder. We can't wait to talk to you again next time to share with you what's going on in your community and the positive aging experience. Thanks. Have a great day.